Good evening. My name is Sanjay Reed, EMT attached to the Nickel Fire Station, and today I'll be doing a brief presentation on pharmacology. I'll explain a little on the types of medication used by EMTs, the indications, the contraindication, the route of administration, and the side effects. Right? You, my viewers, after viewing this presentation, will have a better knowledge of pharmacology and the types of drugs that are used. Right? Now, pharmacology is basically the study of drugs, their properties and actions, and how it affects the human body. It is imperative to know, though, that when applying drugs, you must know these 5 rights of a patient. You must have the right patient. You must have the right drug. It must be in the right dose. It must be in the right route, and it must be the right time. In addition to that, proper documentation is also imperative, right? I'll now delve into the medication that are used, right, by EMT, and I'll start off by using or expounding a little on oxygen, right? Oxygen is basically a medical gas essential for life, right? And the indication or when you'd want to use oxygen is, for example, in cases where persons have a low oxygen level, like for example in a hypoxic case, respiratory distress, chest pain, shock, right? Trauma cases. One of the contraindications, or when you don't want to use it, or when you have to be careful when using it, is, for example, when a person is diagnosed with, for example, COPD, because that person depends heavily on the hypoxic drive, as CO2 is respiratory stimulant, right? So flooding that patient with too much oxygen would cause a amount of problem with that patient, right? The side effects now of oxygen is, for example, if you use it for a long time, you would have a dry mucous membrane, and it has a potential to create oxygen toxicity, right? Depends on the prolonged high concentration, right? The next medication I'll speak on is aspirin, oftenly called acetylsalicylic acid, right? And this is basically an antiplatelet drug that prevents blood clot formation, right? And the indications are when you want to use aspirin is, for example, in suspected heart attack cases, or person with chest pain of cardiac urgent, angina, right? The contraindications now of this drug is if a person is allergic to, for example, aspirin, or the person has gastrointestinal bleeding or inability to swallow, right? The dosage for this is basically 160 to 325 grams chewable tablets, right? And the side effects for aspirin now is stomach irritation, nausea, vomiting, increased bleeding risk, right? I'll now speak a little on nitroglycerin, right? And this is basically a bronchodilator drug that relaxes the blood vessel, or in other words, it widens the blood vessel, reducing the heart workload, right? So the indication for this, or when you want to use this, for example, chest pain, for example, angina, or suspected myocardial infarction. The contraindications now is if the person have a low blood pressure, you don't want to administer nitroglycerin, as that would cause more problems in that case, because what the nitroglycerin does, it plummet the blood pressure, right? So if the blood pressure is already low, it will cause somewhat a problem. The next thing, if the person for example, take erectile dysfunction drugs, within a 24 to 48 hours time frame, you don't want to administer nitroglycerin, nor if the person have an head injury, because that can cause a problem. This can be administered sublingual, right, which is below the tongue, 0.3 to 0.6 milligrams. Some of the side effects, though, of this drug is headache, dizziness, hypertension, burning under the tongue. Yes. And the next drug I'll speak on is epinephrine. And epinephrine is basically a vasoconstrictor drug and a bronchodilator drugs, right, which is used in, for example, cases of severe allergic reaction, right? So The indication as mentioned are when you want to use this is, for example, person with anaphylaxis, which is severe allergic reaction, right? And airway swelling and severe difficulty breathing. You don't want to use this though if it is not a life-threatening emergency. The dosage for this is 0.3 for adult, and that is intramuscular, right? And 0.15 intramuscular for child, right? The side effects though for this drug is increased heart rate, anxiety, tremors, sweating, and dizziness. The next drug I'll speak on is glucose. Basically a simple sugar that raises blood glucose level quickly, right? The indication for this is cases like hypoglycemia, right? And in conscious patient, right, able to swallow. And the contraindication for this is that if the patient is unconscious, you don't want to administer glucose, right? Yes, and the dosage is 15 to 25 grams orally, gel paste, or repeated where necessary, where needed. The side effects though is nausea and vomiting, which is in rare cases. The next drug I'll expound a little on is activated charcoal, right? Activated charcoal, and this is used in cases, for example, poison or overdose by ingestion, right? And the contraindication for this is basically you can't use this in an unconscious patient, right? The patient should be allowed to swallow, right? And the dosage is 1 gram per kg body weight, right? And the side effects of this drug is nausea, vomiting, black stool, and constipation. Now, that concludes my brief presentation on pharmacology, and I hope this presentation, assist you in letting you know a thing or two in regards to pharmacology and the medication that are used in our scope of practice. I thank you.